A diabetic mom caught a fever. This is why her kidneys stopped working. MC is a 49-year-old woman presenting to the emergency room with confusion, abdominal pain, and respiratory distress. Her son, Andrew, tells the admitting nurse at admission that she had vomited 4 times over the last hour. 5 days ago, MC started to develop a sore throat after attending her son's high school football game. Some of the other parents by her were coughing and sneezing. She was concerned that she may have caught the flu from them, so she took massive doses of vitamin C. It didn't seem to work because she quickly started to get a fever. She was getting busy at work and couldn't afford to be sick, so she bought 3 over-the-counter fever medicines and she took them together. She made sure to only take the recommended dose for each one. Overall, MC wasn't particularly healthy. She had type 2 diabetes, which had been worsening over the last few years, but still decently controlled by the medicine metformin. As a typical person with diabetes, she also had high blood pressure and kidney disease, both of which were controlled by the medicine enalapril, whose class derived from the venom of the Brazilian pit viper, as that venom would, among other events, drop blood pressures, and in humans, we use it in a controlled fashion as a medicine to alter some of our hormones to control blood pressure. At one point, it did cross her mind that she may have been taking too many medicines for her fever, but the over-the-counter drugs seemed to be working, so no problem. 4 days after taking all of her medicines, MC went out to dinner and she started to feel some stomach pain. After passing some diarrhea, she thought that she may have had some kind of food poisoning, so to remedy this, she took some anti-diarrheal medicine, drank some water, and didn't eat or drink for the rest of the day because she simply wasn't hungry or thirsty. And interestingly enough, she didn't have to use the bathroom for the next 24 hours. The next morning, MC woke up in a pool of cold sweat, dizzy and confused. She tried to work from home, but she couldn't focus. Nothing she read made any sense. Her stomach would start cramping and she couldn't stop sweating. She could feel her heart skipping. As her son Andrew came back from school in the afternoon, he found his mother laying on the floor, huddled over while clenching her stomach. He calls 911 and she arrives to the emergency room where we are now. Given this patient's history of present illness, it's not entirely obvious as to what's wrong, but there are a few clues. Most immediately, a blood test reveals that she has profound acidemia, a major acid presence in blood. Acid is a measure of hydrogen ions in your blood. This hydrogen is what makes vinegar and lemon juice sour. Cells need this hydrogen to function, but if there's too much of it, then the cells can become deformed and damaged. If the blood is just 5 times more acidic than normal, that can be incompatible with life, and in MC, her blood is more than 5 times more acidic than normal, which leads us to the first clue. Humans maintain acid balance quickly through the lungs and the kidneys. This should make sense because both of those organs indicate a net flow out of your body. You breathe air out, which has carbon dioxide, which exists in your blood as carbonic acid, and your kidneys produce urine, which can be 300 to 300 times more acidic than blood. But if MC hasn't used the bathroom since she took the anti-diarrheal medicines yesterday, then it means that the acid has not left her body through the urine. So then it must be trying to go out through her lungs, explaining why she's in respiratory distress at presentation, breathing quick, deep, and labored. But if nothing has entered her body since she didn't eat or drink for more than a day, then where is this acid coming from? Further analysis of blood samples finds that MC is suffering from lactic acidosis. Osis meaning illness caused by lactic acid, which is a byproduct of your body's metabolism, famously and wrongly known as the cause of sore muscles during exercise. And MC hasn't been exercising. So something else must be causing her metabolism to go wrong. And because diabetes is a disease centered around sugar, which is the fuel used by cells to yield energy, the very definition of metabolism, then this leads us to the next clue. Diabetes is a hormone disease. Insulin is that hormone. Insulin is made by the pancreas, and it's released into your blood after you eat. When you eat, sugars enter your blood from your mouth and your small intestines. These sugars can't just diffuse across the cell membrane, they have to actively be transported in, and insulin is the hormone that enables that transportation, and only once that sugar is in the cell can it then be converted to energy. In type 1 diabetes, patients' pancreas is dysfunctional, so they don't make insulin, meaning that the sugar in their blood stays high and it never gets into their cells. These cells begin to waste away and eventually die off, and before the discovery of insulin, type 1 diabetes was a death sentence. But there's also a type 2 diabetes where the patient's pancreas is functional. Insulin is made and it's released, but the cells no longer respond to that insulin. In response, the body believes that it's starving because no sugar is going into the cells, so it commands the muscles and the liver, which are both primary storage sites of sugar, to release even more sugar into the blood. And that's sugar which will never enter the cell because those cells are resistant to insulin. So let's go back to MC's past medical history. She has type 2 diabetes, so her body makes some insulin, though less than normal, but her cells largely don't respond to it. Given that she's presenting with lactic acidosis and that her body is producing this acid through her metabolism, then her diabetes must be responsible for her condition. But we need to go further. Sugar is stored in both the muscle and liver tissue, and in a type 2 diabetic, these tissues constantly leak this sugar out into the blood. We know that she wasn't exercising, ruling out the muscle, so then that leaves the source of her acidosis to be her liver. Because she doesn't have a history of liver disease, and we know that all oral medicines, which are the ones that she took, go from the stomach to the small intestines, then must pass through the liver first, then it means that the next clue is in her medication list. Metformin is the first-line pharmacologic treatment for type 2 diabetes. It works by decreasing the liver's production and release of sugar into the blood. That doesn't give us much information on MC's acidosis, but metformin also works in the small intestines by enhancing the conversion of sugar to a compound called lactate. So instead of sugar getting stored into the liver, it's lactic acid. This lactic acid is usually broken down by the liver, and if MC doesn't have prior liver dysfunction, then she should be breaking down this lactic acid, right? Yes, but let's go back to how the body maintains acid balance, which is really just a more specific form of managing waste. The lungs are important because you breathe out carbon dioxide, which is a waste product of metabolizing sugar to energy. The gastrointestinal tract is important because it can concentrate some of that acid in poop, but that process is slow. The liver is important because it breaks down chemicals, drugs, and wastes by turning them more water-soluble, meaning that they dissolve in water. And because all of the body's water is eventually processed by the kidneys, then it means that lactic acid broken down by the liver should be going to MC's kidneys. But if she hasn't produced any urine for more than a day and her medical record notes that she has kidney dysfunction due to her diabetes, then it means that her acidemia and lactic acidosis must be because of her kidneys. Do you remember that blood pressure medicine, enalapril, that MC was taking? Well, enalapril is supposed to protect the kidneys in diabetes by vasodilating the efferent arteriole. This means that it relaxes the blood vessels that lead out of the kidney, lowering the resistance of flow and decreasing pressure. You want this in a diabetic because excess blood sugars will complex with the proteins and accumulate in the kidney, and this buildup can damage the blood vessels. If MC's kidneys have no problem letting blood flow out of the kidney, but she hasn't produced urine for the last 24 hours, then it means that there's been little to no flow into her kidneys. The fever medicines that MC took were aspirin, ibuprofen, and naproxen. All are drugs of the same class called non-steroidal anti-inflammatory drugs. They relieve pain and reduce fever, but they also constrict the blood vessel leading into the kidney. And because MC took all three together while taking enalapril, it means that there was limited flow in and a lot of flow out of her kidneys, drying them out and allowing metformin, which isn't metabolized by the liver, to accumulate in the body, producing more lactic acid and making her blood 8 times more acidic than normal. Her past medical history all point to this. The respiratory distress, the profuse sweating, the mental decline and vomiting. If this goes untreated, the proteins in her body will quickly become denatured and her enzymes will stop functioning as she becomes consumed in an acid bath of her own blood. The accumulation of toxic waste is a recurring physiologic theme when it comes to causes of death in humans. An alcoholic can have a cirrhosed liver, that is, a liver 99% damaged or scarred. And this is a time when ammonia, which comes from the breaking down of proteins in the small intestines, isn't processed by the liver because it's not functional. This ammonia begins to spill into the blood and accumulate in the body, altering the metabolism of the brain, causing a functional impairment called hepatic encephalopathy. In the case of suffocation from drowning or opioid overdose, the cessation of oxygen flow into the body causes hypoxemia, or a low oxygen presence in blood. Carbon dioxide begins to build up in the blood, manifesting as carbonic acid, and this lack of oxygen in the brain can force the brain cells to die, causing permanent brain damage. A genetic disorder called cystic fibrosis mutates every single cell in the body and results in aberrant chloride transport in cells. This leads to abnormally thick mucus that cannot be cleared easily. This mucus accumulation causes the lungs to chronically be infected as there's minimal flow out, and in some cases it can cause pancreatic enzymes to seldom be released outside the pancreas, enabling those enzymes to digest part of the pancreas itself, resulting in malnutrition and eventual cystic fibrosis-related diabetes, which has characteristics of type 1 and type 2 together, as the pancreas's function is severely diminished, decreasing its ability to produce insulin. And because the implication of a disease centered around a hormone, like diabetes, is based on the hormone's presence or lack of response to its presence, the mass balance concept of accumulation is a fundamental physiologic concept that describes MC's case. At this point, the easiest way to treat her is to use the same chemistry that was used to identify her acidosis. If acidemia is a measure of excess hydrogen in blood, then neutralizing it with a base like sodium bicarbonate would react with the hydrogen to produce water. She's aggressively hydrated so that her blood pressure is temporarily higher, increasing flow through the constricted afferent arteriole of the kidneys, forcing water through, and then she started on dialysis, which filters the blood and removes wastes that functional kidneys would have caught. 48 hours after presenting to the emergency room, MC's metabolic abnormalities began to normalize. Blood pH began to rise back to normal levels, and upon resolution of her confused and altered mental status, copious urination preceded her hugging her son for the first time in days. Thank you to Audible for sponsoring this video, of which I'll donate part of the proceeds to the Shriners Hospitals for Children, and then I'll personally match that donation. So if you'd like to help out, please check out Audible in the link in the description below. There's a great medical story that I wanted to share with you that you can get for free through that link. It's called The Butchering Art by Dr. Lindsay Fitzharris, who I met back in Halloween of 2017. The story is that of Dr. Joseph Lister and his path towards revolutionizing surgery through antiseptic technique, which virtually changed surgery in almost every aspect, and also maybe the course of human history too. The Audible version is narrated by Ralph Lister, who is a relative of Joseph Lister. And the great thing about medicine is that you can still read Dr. Lister's publications on antiseptic principle that were written in 1867 and published in the British Medical Journal. And if you don't like it, you can exchange for a different book or cancel within the month. Audible.com/chubbyemu or text chubbyemu to 500 500. Again, audible.com/chubbyemu or text chubbyemu to 500 500. Thank you so much for watching. Take care of yourself and be well.